Hello and welcome back to my channel. Today we're going to dive into an important health topic that often doesn't get the attention it deserves, vitamin B12 deficiency. This condition can have serious consequences if left untreated, but the good news is that it's entirely manageable with the right approach. We'll be covering what vitamin B12 is, the role it plays in your body, the symptoms of deficiency, and most importantly, how to manage and prevent this condition. Hi, I'm Dr. Knapp, family medicine physician here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays a crucial role in many of your body's processes. It's involved in the production of red blood cells, which carry oxygen throughout your body. B12 also helps in the synthesis of DNA, the maintenance of nerve cells, and the metabolism of every cell in the body by helping to convert food into energy. Because of its involvement in so many fundamental processes, having the right levels of B12 is essential for your overall health and well-being. Your body cannot produce B12 on its own, so you need to get it from your diet. It's naturally found in animal products like meat, fish, poultry, eggs, and dairy. For vegetarians and vegans, or those who don't consume enough animal products, fortified foods or supplements are often necessary to meet daily needs, although some seaweed, shiitake mushrooms, and nutritional yeast do contain B12. So how does someone become deficient in vitamin B12? There are several potential causes. Firstly, dietary deficiency is a common cause. As I mentioned earlier, B12 is found mostly in animal products, so individuals who follow a strict vegetarian or vegan diet are at a higher risk of developing a deficiency. Another major cause is malabsorption. Even if you consume enough B12, your body might not be able to absorb it properly. This can happen due to various reasons, including certain medical conditions like pernicious anemia, which affects the stomach's ability to produce a protein called intrinsic factor that's necessary for B12 absorption. Other gastrointestinal disorders like Crohn's disease, celiac disease, atrophic gastritis, or bariatric surgery can also interfere with absorption. Certain medications can contribute to B12 deficiency as well. For instance, long-term use of proton pump inhibitors or H2 blockers, which reduce stomach acid, can lead to impaired absorption of B12. Similarly, metformin, a common medication used to treat type 2 diabetes, has been linked to B12 deficiency. Finally, age is an important factor. As we age, our body's ability to absorb B12 decreases. This makes older adults more susceptible to deficiency, which is why it's often recommended that people over the age of 50 get their B12 levels checked occasionally. Recognizing the symptoms of B12 deficiency is crucial because they can be subtle and are often mistaken for other health issues. One of the most common signs is fatigue. If you find yourself feeling unusually tired, even after a good night's sleep, it could be due to lack of B12. Another symptom is weakness. This can manifest as difficulty in performing everyday tasks that once seemed easy. Shortness of breath and dizziness are also common symptoms, especially if the deficiency has led to anemia, a condition where your body doesn't have enough red blood cells to carry oxygen effectively. Neurological symptoms are also a hallmark of B12 deficiency. These can include numbness or tingling in the hands and feet, difficulty walking or balance issues, and cognitive changes like memory loss, confusion, or even depression. In severe cases, a deficiency can lead to irreversible nerve damage, so it's essential to address these symptoms promptly. Other symptoms can include a swollen or inflamed tongue, mouth ulcers, vision problems, and pale or jaundiced skin. If you experience any of these symptoms, especially in combination, it's important to see your doctor to get your B12 levels checked. If B12 deficiency is suspected, your doctor will typically order a blood test to measure the levels of B12 in your body. In some cases, additional testing may be needed to determine the underlying cause, such as checking for antibodies that indicate pernicious anemia or testing the levels of methylmalonic acid and homocysteine, which can be elevated in B12 deficiency even when B12 levels are borderline. Once a diagnosis is confirmed, it's time to talk about management. The good news is that B12 deficiency is entirely treatable, and the treatment is usually straightforward. The approach to managing B12 deficiency largely depends on the underlying cause and the severity of the deficiency. For mild deficiency, dietary changes may be sufficient. Increasing your intake of B12-rich foods like meat, fish, eggs, and dairy can help boost your levels. If you're vegetarian or vegan, or if you have difficulty absorbing B12 from food, you might need to incorporate fortified foods or take a B12 supplement. There are a variety of supplements available, including tablets, sublingual forms, and even fortified nutritional yeast. In cases where dietary changes aren't enough, or if the deficiency is more severe, B12 injections might be necessary. These injections bypass the digestive system and deliver the vitamin directly into your bloodstream, ensuring that your body can absorb it. Depending on the severity, you might need these injections weekly or monthly until your levels are restored to normal. After that, a maintenance dose is often recommended, especially if the underlying cause of the deficiency isn't fully reversible. For those who prefer not to have injections, high-dose oral supplements can also be effective, especially in cases of dietary deficiency. These are available over the counter or by prescription, depending on the dosage required. It's important to follow up with your doctor after starting treatment to ensure that your B12 levels are improving and to adjust the treatment plan as needed. In most cases, symptoms will begin to improve within a few weeks of starting treatment, but full recovery, especially from neurological symptoms, can take several months. I just want to take a moment to ask that you hit that like button, subscribe to my channel, and leave a comment below if you have any topics you want discussed in future videos. Anyway, preventing B12 deficiency is equally important. For those at higher risk, such as older adults, vegetarians or vegans, or people with certain medical conditions, regular monitoring of B12 levels may be recommended. Routine blood tests can help catch a deficiency early before symptoms develop. If you fall into a higher risk category, consider incorporating B12 fortified foods or a B12 supplement into your daily routine as a preventative measure. Even if you consume animal products, if you're over the age of 50, a supplement might still be necessary due to age-related absorption issues. For those on medications that interfere with B12 absorption, like metformin or a proton pump inhibitor, talk to your doctor about monitoring your levels more closely or whether you should take a B12 supplement as a precaution. Vitamin B12 deficiency is a common but often overlooked condition that can have serious health implications if left untreated. However, with the right knowledge and proactive management, it's entirely preventable and treatable. By understanding the causes, recognizing the symptoms, and knowing how to manage and prevent deficiency, you can protect your health and well-being. Thank you for watching. As always, take care of yourself and make the most of your day.